All right. In today's episode, we're going to finally answer that question. What is the difference between a psychologist and somebody like me, which is a professional counselor? Now, there's a lot of similarities, don't get me wrong, but we're trained sometimes very differently. For instance, in a nutshell, psychologists typically more specialize in abnormal psychology, right? More advanced disorders, typically personality disorders and things like bipolar and various other severe diagnoses like dissociative identity disorder. But with that said, with additional training, professional counselors can also treat those populations as well. So it gets really confusing, and especially the educational requirements, it's very ambiguous. And to tell you a quick story to kind of get your minds going in that direction when it comes to our differences, I remember the first psychologist that I met outside of my educational pipeline, because don't forget, many of my professors were psychologists. When I met this individual working in Old Saybrook with one of my first formal jobs doing this type of work, he saw the fact that I had a motorcycle because that day I actually was holding on to my motorcycle helmet. So the psychologist looks at me, looks at my helmet, looks at me again, and he laughs to himself and he says, "Oh, so it looks like you have a secret wish for death." And so I looked at the psychologist. I'm like, that makes absolutely no sense. But later on, I thought about what he said, right? And to some degree, right, we can definitely break apart the fact that a person that has a motorcycle is more willing to take chances, right? To put their life in jeopardy because we all know the statistics associated with a motorcyclist getting into a car accident versus somebody that has a seatbelt and is surrounded by a steel frame. So there is some truth to that, but the way that he framed it and to the degree that he was kind of portraying me was completely inaccurate. But in a lot of ways, having a psychologist perspective is refreshing because they look at things maybe a little bit differently than us professional counselors. So with that said, let's go over some of the commonalities and differences between professional counselors and psychologists. All right, let's get started. So to get started real quick, I want to point out something that I just learned today when it came to going through the CT REAP program, right? Almost like the Job Posting Center for teachers and pretty much most of academia that's K through 12, especially in public schools. So with that said, since obviously my transitioning practice right now is in Essex, I looked at the school psychologist posting that was actually number one when it came to the whole list of school psychologists postings that currently need to be filled. And so if you look down here, when it comes to the bachelor's degree or higher requirement when it comes to what they're looking for, I was really surprised to see that just because this state of Connecticut 070 certification requires currently a master's degree. So maybe some of the older school psychologists have lesser degrees than I even expected myself. So something to keep an eye out for when it comes to the differences between various types of psychologists even. So my understanding when it comes to psychologists have to do with the levels of degrees in psychology. So back in the day, right, a bachelor's degree in psychology had a lot more clout than nowadays. And especially a lot of these licensure boards and associations like the American Psychological Association now pretty much is strongly encouraging psychologists to go from their bachelor's degree straight to their PhD or their PsyD or their EDD without even going through their master's programs. So a lot of older psychologists you'll see, the ones that probably in their 50s or 60s, might still have their master's degrees. Or psychologists that choose to teach versus have a clinical practice, you might still see that. And there most certainly are programs being offered still that have master's in psychology degrees. But with that said, it's almost like a dying breed where you're going to see less and less of that. Just because, again, when it comes to the APA, they're looking more for that clinical prowess, right? And since they do offer more of a abnormal psychology background, of course they have to be the experts in their fields. It makes perfect sense. And for those of you that don't know Psychology Today, it's a great resource both for educating yourself when it comes to what we have to offer, and that's all providers, including psychologists and counselors, but also when it comes to finding a counselor or psychologist. There is, my opinion, no better resource as of today when I'm actually making this video. So if you're looking for a counselor, if you're looking for a psychologist, and you're most certainly trying to see if whether or not they have open availability and what insurance that they accept, this is a great directory to use in order to do that. With that said, let's look at this article, which is psychologist versus therapist versus counselor, right? What are the differences? And that's done by Abigail Fagan. So let's take a look at what she has to say. And the key points of this article are that psychologists, therapists, and counselors have different training and approaches. That's very true. But there's also a lot of commonalities and crossover that we can do. A psychologist training may delve more deeply into science, theory, and practice of psychology, which is especially true between a doctoral level psychologist and a master's level counselor. Makes perfect sense. Counseling tends to be shorter term and goal orientated, and it addresses concrete, specific life challenges, which is also completely true. Typically, if you're in the services of a psychologist, we're looking at years you being with that provider, right? Versus a counselor, it could be 12 weeks to a year or two. Typically is what I see, right? And that's more for maintenance versus goal-driven clients that I have. So the difference being, right, between a maintenance and goal-driven client would be we have tangible goals associated with why a client comes to see me, right? Which typically is more limited. And once you reach those goals, say have a job for 6 months, have a relationship for a year, get that house you always wanted, right? Whatever those goals might be, eventually once we touch them, or once they become tangible, then if it's sustained and maintained, you're good to go. When it comes to maintenance-based clients, well, guess what? Those are individuals that may have more of a stressful work environment or relationship environment, right? Maybe you want to have a long-term relationship with somebody with bipolar disorder, right? And maybe every once in a while they stop taking their meds and what that looks like and what that does to your own psyche. Or maybe you are a prison guard, right? A corrections officer or police officer. Or maybe when it comes to whatever other type of work environment that you're in, you see some funky stuff, right? Maybe you work in the ER. Maybe you're a air traffic controller, right? Whatever that stressful job might be, maybe something kind of comes up and about every single week that you need to kind of process and make sense of, which, typically we as counselors, we thrive in. Psychologists, right, typically are more in the domains of trying to ensure that you do things like your activities of daily living, that, again, you continue to take your medications, that when it comes to whether or not you're having a proper cognitive ability or reasoning and judgment, that you can show up to work every single day, that you do have the faculties towards, leading a successful life when it comes to not having to become institutionalized. And if you cross that threshold, of course, that psychologist will be with you for those higher degrees of care that we offer, right? When it comes to IOPs, PHPs, so if you don't know what those stand for, intensive outpatient programs, partial hospitalization programs, or even residential or inpatient programs that are out there. And psychologists are really good at assessing those stages of your treatment. And of course, at the bottom here, coaches do not tend to treat mental health disorders, right? And that's an important one. So there's some major differences between a life coach or a career coach and a master's or doctoral level counselor, and most certainly a psychologist, right? They have a lot more training. And we often disagree with a lot of what coaches will give you for advice. And that's another thing, too, with advice, right? A therapist is less inclined to want to offer advice. We're trained that way. We want you to come up with your own solutions, right? We might ask you a rhetorical question even, right? Like a Socratic question, already knowing the likely answer you're going to provide to us just because we want you to come up with it, versus maybe a psychologist we will be a little bit more directive, saying that, hey, listen, you need to stop cheating on your husband, or vice versa, right? All right, so going down to a psychologist has a doctoral degree, such as a doctorate in philosophy, which is a PhD, or a doctorate in psychology, which is a PsyD. They may also have a EDD, if you look down here, right? And that's an emerging designation for a lot of both counseling and psychology-based providers. And it may dive more deeply into science, theory, and practice of psychology and human behavior. They specialize in things like psychosis and personality disorders, and may also, like I said before, teach. And depending on their function, right, if they're functioning as a therapist because they're conducting psychotherapy, then they also can receive that designation, along with licensed clinical social workers, licensed marriage and family therapists, and of course my provision as well, which is licensed professional counselor. And going over counselors down here, counselors tends to have shorter term goal-orientated treatment, right? Like we discussed before. And typically we deal with less severe psychopathology, even though we're more than qualified towards handling some of those more severe diagnoses, as long as we've had the specific training. And then we can specialize in marriage, addiction, grief, abuse, drug and alcohol addictions, right? The whole gamut when it comes to our credentialing rests on our simple education, how we've been trained. And so at least my designation when it comes to how I've been trained, at least with my master's program, had to do with me being a licensed professional counselor with a mental health designation, right? And that's very relative to what you're seeing here. Versus my doctoral program being more community-based counseling and traumatology. So I specialize in trauma. And this is really important to point out down here. When it comes to coaches do not tend to treat mental health disorders. Even though, again, when it comes to peer support, they're vital when it comes to that component, they are not qualified to A, diagnose you, and B, to have a treatment plan associated with that. So that's really important to understand because literally with new clients, I've gone sometimes head to head with their current life coach or career coach where, again, they have such a pull or influence on my client that's really hard for them to break away with their advice that they continuously give, which might conflict with mine. And for those of you that don't already know, even though this is really about counseling and psychologists, psychiatrists typically focus more on medication. Even though they can provide counseling, and they do at times, it's more lucrative for them with their business model to do that 15-minute medication check. So you see them typically more do that. And also, we go to them on a regular basis with anything that's biologically related, right? What are the best supplements for you to take? What are the best medications would be appropriate for a given disorder? When it comes to what type of test, like an fMRI or a EEG or something like that, right? Typically, psychologists are more inclined to have a background and what's going on inside of you, which typically we have a basic understanding of, but we're not proficient in your physical biology. Now, granted, when it comes to self-study, that might be a little bit less true, but again, when it comes to the legality of all this, psychiatric APRNs or APRNs, nurse practitioners that have master's degrees or higher, and psychiatrists that have medical doctorates or related degrees typically are a lot more proficient in these matters and should be considered as the authority in these matters. So if you're a big avid fan of TV personalities like Dr. Phil, needless to say, if you see a counselor after years of watching such a TV series, that counselor might disappoint you, right? That counselor may not give you direct advice, might even refuse to give you direct advice, and might want to evoke or elicit that advice from yourself, which is a different direction. Not saying one's better than the other. I'm just saying that when it comes to what a client needs, that varies depending on, again, their background, their culture, right, and your expectations when it comes to treatment. But especially for individuals that have already seen psychologists in the past, and with counselors being more of an emerging field, right? Because don't forget, psychologists have been around for a long time, right? So we're talking that a psychologist, their profession has been around for about 100 to 150 years. While a social worker might be more trailing a psychologist by about 50 years, right? So clinical social workers really have been around for about 120-ish years, while marriage and family therapists have been around since the 1940s and early 1950s. And of course, provisions for the modern health counseling, which is most related to my profession, started becoming organized in the 1950s and was official pretty much in 1963 with the Community Health Act, which helped develop modern counseling into what it is today. Well, hopefully this video provided a little bit of insight between the differences of a psychologist and a professional counselor. Now, granted, right, we professional counselors typically pride ourselves in being less confrontational and cherish the therapeutic alliance just as much as a psychologist would, but maybe in a different way, right? Like, for instance, Maybe a psychologist would be more willing to take notes because, they really value what you have to say. And it's part of that assessment process, right? Where maybe a phrase or word or something that you said will be vital towards them coming up with a diagnosis. We as professional counselors say to ourselves, well, every time I write something down, that might be intimidating to the client and obviously might be dismaying or off-putting towards that therapeutic alliance we're trying to establish. And also, if I'm writing something down, I may not be listening to the rest of what you're currently saying. So, and that has to do with that whole medical model that typically psychologists and a lot of clinical social workers and other providers, even a marriage family therapist might be more in line with that expert model or role, might be in line with. However, when it comes to professional counselors, again, we believe that change sincerely happens from the ground up, right? Such a change has to do with a willing participant that on their own accord, because they want to or they're driven to, through that therapeutic alliance and that relationship with their provider, makes the changes on their own accord versus any type of coercion or manipulation or being tricked into doing anything. Now, I'm not saying psychologists do that, and most certainly there are psychologists that prefer our model when it comes to how they do their clinical work. However, you see more psychologists in the expert role and more psychologists in the evaluating roles associated with, all sorts of research programs, or maybe at more advanced institutes or institutionalized programs for individuals that have more severe psychopathology, right? And also, don't forget, they have emergency powers when it comes to referring them to a hospital setting or program, and typically have a little bit more clout when it comes to other types of referrals. Like, for instance, as a brief example, if I was going to do a BRS referral, a Bureau of Rehabilitation Services referral for the state of Connecticut for like a work program, I can't do that referral myself, and typically look for other providers, especially a psychologist, to do a referral like that, or even that person's PCP. But because of politics, right, even though we have a lot of these same assessment capabilities, I can't make that referral, at least not directly. And typically the way I get away with it is I have the client fill out the form with me for self-referral. So with that said, there's some major differences between or at least how a psychologist and also a licensed professional counselor operates. All right, well, hopefully you enjoyed the video and stay tuned towards our next one.